Hey, solopreneurs and everybody else. Today, I have an inspiring story for you. Meet Karen, a warrior who transformed her life. In 2009, Karen was 160 pounds overweight and dealing with stress and diagnosed with aggressive breast cancer. She took charge, she researched, and changed her lifestyle, losing 135 pounds and beating cancer. But that's not all. In 2017, she survived a heart attack, and then she bounced back even stronger. Karen is now a national board certified health and wellness coach. She helps women beat heart diseases, diabetes, high cholesterol, high blood pressure, and helps you get your life back. Are you ready to get inspired? We want to hear all about Karen's journey, from Karen to you. Karen, your story is incredibly inspiring. Let's dive a little bit into your journey. First and foremost, how and why did you get into coaching?
Well, thank you for asking that, Summer. Thank you for having me here. The reason I got into coaching is because of what I went through. And when I went through the cancer, I did a lot of research and I realized that one of the things that feeds cancer is the lifestyle I was leading. Cancer loves it when you don't have enough sleep, or you're under a lot of stress, when you're eating the standard Western diet. It's often called the standard American diet, but I'd like to expand that to the standard Western diet, because it's not just the Americans that are eating that way. And just living the lifestyle that we live in the continental United States. And so I wanted to do something about that. I didn't want to have that happen to me again. And what I did is I did a lot of research. I realized that the way I was treating my body was going to set me up for recurrence, because my type of cancer has a very high recurrence rate. And I didn't want that to be my story. So I changed my diet. The first thing I did was change my diet incrementally. It wasn't just all one fell swoop, but I changed my diet, lost 135 pounds, as you said. I overcame a sugar addiction. I also, at the same time I was diagnosed with the cancer, I was also pre-diabetic, and I had known that, but I wasn't doing anything about it. It wasn't until the cancer came along that I decided that this was a wake-up call for me. This is something. You get these little kind of nudges, and then if you don't listen to the nudges, then you get the big brick on your head, and that's what the cancer was—a big brick on my head. I knew I wasn't healthy. I was short of breath all the time. I was tired all the time. I wasn't sleeping well, all the things. I was in a lot of pain physically. So the brick on my head obviously was the cancer. And I decided, okay, I got to do something about this. And I did. And at the time that when I lost the weight and I changed everything, all the aches and pains went away. I was sleeping better. I was able to manage stress a lot better. So stress is inevitable, but how you manage it is what matters, right?
Yes.
So I also overcame my pre-diabetes. That was a sort of a side effect of having done all the stuff that I did, is I overcame the pre-diabetes, and I haven't looked back. I haven't had to worry about that anymore. So I decided along the way, as I was learning all this stuff, that I really wanted to help other people do the same thing, because I felt amazing. I felt better than I did. So I was 52 when I was diagnosed. I felt better than I did when I was in my early 30s. So 20 years later, I was feeling better than I did when I was in my 30s. And I wanted to share that with people. So I became educated. I became a certified holistic health coach, and then ultimately I became a certified nutritional consultant. So I just added on to my knowledge base. And then I became a board certified health and wellness coach, so that I could help people in the medical system. I could help you there. I could help people institutionally as well. But I feel this is information that is readily available to people, but it's buried under all of the marketing noise that we get from the food industry. The food industry runs a lot. They're able to control the messaging a lot, and you have to dig up underneath of that in order to find out what's really happening, what you're really eating. And that's really where that's my passion, is to show people how to take care of their bodies so that they can thrive and overcome potential, or significantly reduce their risk for chronic illness that is as a result of their lifestyle and nutrition choices. That's the long-winded version.
That's amazing. You are incredible. Your dedication to transforming your life is remarkable. Now I'm curious about one more thing. Why and how did you choose who you are targeting? Who are you speaking to? Who is your target audience?
So when I had the heart attack, when I had the heart attack in 2017, I was asked to become a Women Heart Champion community educator. So a Women Heart Champion, and then I decided to become a community educator so I could talk about women and heart health. And I started to learn all these things about heart disease, especially with regard to women, how our bodies are much different than men's. They're much different than men's bodies, and we respond differently to medication. We respond differently to medical devices. We have different symptoms. We have different manifestations of disease in our bodies for various reasons. And I learned a lot about how we influence those diseases in our body by the way we treat our bodies. Again, through lifestyle, through nutrition, through stress management, all of these things, because so much, like 90%, 85 to 90% of heart disease is preventable. Mm-hmm. And so we're bringing that into our lives by the way we treat our bodies day after day, week after week. And so this was a population of people that it's a big population because heart disease is the #1 killer in North America. And this was somebody I could help. This is a group that I could help. I could help people to prevent the onset of chronic illness that is a result of the way they are treating their bodies and living day to day, by teaching them the incremental steps that they need to take in order to reverse that risk, or certainly significantly reduce the risk.
I've known you for a couple of years now, Karen, I think at least for 4 years now. And I love your passion for helping women overcome serious health challenges. And yeah, I've been one of them, and I love you for that. Could you share, other than me, another success story of your clients? I would love to hear about the impact that you've made on somebody.
Sure. I have so many of my clients have been able to change so much of their life that they didn't even realize was necessary. I've had clients, as one specific client that I can think of, she brought her cholesterol down 60 points in a 6 month, actually within about 4 months of working together. We worked together for 6 months. She was a young woman, and she was in danger of having to take cholesterol medicine for the rest of her life. She was in her mid-20s, and she looked perfectly fit. She was very athletic. She was a beautiful young woman, but she was being threatened, or it was been strongly encouraged that she start taking this medication. She worked with me for 6 months, and that risk went away because her cholesterol came down 60 points. And I had another client who was in their 50s, I'm going to say they were in their 50s, who they had high blood pressure and were diabetic, and both of those conditions were out of control on medication. So they could not even medicate their way out of it. We worked together for 4 months, and when they went back to the doctor said, "I don't know what you're doing, but keep doing it because your numbers have never looked this good." And to those kinds of stories, and I have stories like that all over the place, people who have been able to overcome their sugar addiction, because that's huge. That's the big thing, is the sugar addiction. Overcome sugar addiction, bring their weight down into a healthy range, sleep better, have a better relationship with their partners because they have more energy. All of these things, these transformations that they just make my heart sing, because it's just so much fun to watch somebody transform and to come back to life, especially after they feel so desperate. They feel like they've tried everything and nothing is going to work for them. And then all of a sudden we find that magic key for them, and they're able to find the way in that they didn't even realize existed before. And it's just such a cool feeling to have, to be part of that, to sort of guide them in that direction.
Absolutely. I think as a business coach, I feel exactly the same. When somebody says, "Because of Summer, I'm here today," or "Because of Summer, I'm doing this," that's a drug of my choice too. And you have chosen your drug the exact same way, and I love that. Karen, thank you so much for sharing your incredible journey and your insights with us today. Heart disease and cholesterol and blood sugar and all that, they are scary things. Yeah, Solopreneurs and everybody else, if you're listening to us, if you're inspired by Karen's story and you want to take charge of your health, check out Karen's 5 Pillars program. It covers mindset, nutrition, lifestyle, emotional health, and self-care. Did I get all those right, Karen?
You did, yes. Good job.
Awesome, because you've been coaching me well. Are you ready to transform your lives? Join Karen's program, which is a 12-week program, and start your journey today to better health. All details of Karen are in the description below. For more interviews like this, subscribe to my channel and stay tuned for notifications. Don't forget to connect with Karen and me on LinkedIn and Instagram. All the links are below. Thank you for hanging out today, you guys. Until next time, keep getting shit done.